Good morning, everybody. It's Anne Sinclair from Digestive Detective, and today we're going to talk about diverticular disease. So what is diverticular disease? Well, it's a collection of diseases that affects the diverticulum. So what's the diverticulum, you may ask? So they're little out pouches that are formed on the lining of your large intestine. So they balloon outwards. And these pockets are called diverticular, and often they don't cause any problems at all. And that's generally called diverticulosis. Get your tongue around that. So diverticulitis is what happens when those little diverticulosis become inflamed. So they become inflamed often when inflamed and infected, often when little bits of poo basically get stuck in those little pouches. They get trapped in the pockets, and then they cause infection. Generally, you have fevers, stomach pains, all those sorts of things. You'll know if something's going on. Occasionally, once you have diverticulitis, those little pockets can perforate, and then that's really problematic. You need to be in a hospital setting to have treatment for that. So probably diverticulitis is the most common complication that can occur with diverticulosis. Why does it happen? So there are four main factors that contribute to the development of diverticular disease. One is, it's interesting to note that this condition wasn't really a condition until after the First World War. So it's not in any written records before then. So, and it's also known as a disease of the modern world, essentially. So factors that we need to look at are, one is diet, and our Western diet plays a huge part in this because we don't we have a low fiber diet, and it's high in saturated fats and sugars. So low fiber, when you have low fiber, and this is why I bang about it forever, low fiber means slower transit time. Slower transit time leads to our second factor, which is constipation. And lower fiber diets have lower transit time, like I just said, and they also don't have as much stool bulk. So what happens with this is these two factors increase the pressure in the interluminal space that's in the bowel, and they can often cause a blowout because the poo's drying really hard, and it'll cause a little diverticula to blow out. And then that creates the little pouch or the little pockets. So the third thing is unavoidable, and that's generally age. So the risk of getting diverticulosis increases with age. And I would say to you, I've never seen a client under the age of 40 with diverticular disease. And usually, if they did have it, they would be a male, because it generally shows up more there. Research shows that 50-60% of incidence of diverticulitis is over the age of 80. In clinic, I've seen that a little bit more around. I've seen mostly women that are around 50 to 60, and generally it's exacerbated by high stress. Something high stress is happening, and they don't eat as well as they should, and then turns pear-shaped basically. So why do 80-year-olds tend to have more prevalence? Well, a couple of things. Their diet's pretty bad at 80, especially when they're in a nursing home. They don't have as much physical activity as younger people do. Or is it their muscles and cellular health has changed too? So it could be down to that. And the final factor, which we need to, is also a modern world problem, especially in the Western world, is obesity. So the Australian Institute of Health and Welfare in 2017 showed that almost 2 out of 3 Australians were overweight, which is terrible. So not just overweight, but obese. So in the 10 years from 1995 to 2015, Australian adults who were obese jumped from 19 to 28%, which is just outrageous. So individuals with an increase of waist circumference, for men it's around 94, and for women it's 80 centimeters. So if you have a waist circumference that's that high, a higher BMI, and a greater waist to hip ratio, where you measure your hip and your waist and work out the ratio are at a greater risk of developing diverticular disease. And this is generally because they also would have lower fiber, higher fat diets. Perhaps does the increased fat tissues basically can negatively impact the intraluminal space that I talked about before? Perhaps. So how many of these risk factors do you have? Do you have any? Is the modern diet affecting our health? Yes, I believe it is. So tomorrow I'm going to look at the signs and symptoms of diverticulitis, how it's diagnosed, and if you have diverticulitis, you want to book in and come and see me, so that way then you can get on track. There's some really simple things, especially with diet, that you can do that can prevent having an outbreak of diverticulitis. I've got a friend who was hospitalized with severe diverticulitis last week, almost to the point of perforation, and she's a naturopath. So and diet, she said at the Christmas period her diet had been considerably changed because there was lots of stress in her life, and her diet had changed, so this impacted on how her body was reacting to that. So I will see you tomorrow. I look forward to it. Have a great day, everybody. Bye.